Good evening. Welcome to Health Talk. I'm Dr. Kenny Levine. Streaming live on the web at WEYW19.com, seen on Uverse, Channel 19, and on Comcast, Channel 87. This is a new Health Talk show in South Florida. It's not a show about dentistry. It's a show about medical issues that go from the top of your head down to the bottom of your feet. I mentioned dentistry because I'm a dentist. I'm a periodontist. You know, over the years, my training has been to treat gum and bone disease, but today we treat patients of all ages, from 3 to 4 days old up to 100 years young. Our focus today is on prevention. Our focus is on cosmetics and aesthetics and dental implant therapy. Our goal is to keep our patients' teeth in good health, function, and aesthetics for the remainder of their lives. I want to emphasize that our show is not about dentistry alone, and in fact tonight I have one of my dear friends with me, Marc Decker. Marc happens to be my personal trainer to the stars. Marc, welcome.
Thank you, Kenny. Nice to
Good to see you. How did you get started in training?
Well, I originally got started when I was young. I was always into sports, and I was going to school at Florida State. I went to school, and from then I was tossing over whether I wanted to be a doctor, chiropractor, or something in sports medicine. And I weighed out my options, and I didn't like blood, so that was a no good. I heard too many things about the business of chiropractic, so I didn't go into that. And so I landed up in sports medicine and an emphasis into personal training. I started out in Los Angeles, where I started at a gym called Equinox.
Right.
And from there, I eventually grew and grew, got more certifications, and eventually went on my own to start my own business.
How long were you out in California?
I was out in California for approximately 8 years.
You know, you're my trainer, and one of the things I say to trainers, I don't want to become a bodybuilder. I don't want to look like those guys in the gym. What's the difference between training and becoming a bodybuilder?
Huge difference, totally difference. What you're talking about is actually a lifestyle of just being active and healthy. Bodybuilders is a totally extreme to that case. The dedication, the hours they put in, it's almost like a radical versus a normal lifestyle. I train mainly for what you do, active lifestyle. You know, for my health, make sure that everything I do during my day, the functionality, I can do it. For example, you work in dentistry, you're hunched over a lot. So first thing I'd also do is now strengthen your back muscles to help with your posture. Right. And so I make my training as functional to your daily routine as possible.
Let's go to the other end of the spectrum. Okay. Older people much older than I. Is there an age at which people shouldn't be training, or should they be training forever?
They should be training, if they can move, they should be training, as long as it's approved also by their doctor. Obviously, know your demographic, know your client. You know, if my client's 75 years old, I'm not going to have them doing plyometrics with, say, like jumping movements. They don't need that. Your goals should change with your age. Okay, they're not competing in any run or races, anything like that. Okay, so what do we do? When you get older, what are more concerns? Balance, coordination, you know, you don't want to fall. Okay, so make sure your hips are strong. You know, you're going more for that instead of, say, like a sport game.
Okay, and is there a difference between men and women?
Yes, there's a difference between men and women.
I know there's a difference. What I really mean, in training, is there a difference between men and women?
The difference is that women have been like just beaten in the media by, oh, I'm going to bulk up, I'm going to get all this, I'm going to bulk up. When essentially is the only thing that bulks someone up is their diet, their food intake. Okay, when someone wants to bulk up, whether it's a man or a woman, you intake more. When you don't want to bulk up, you don't take in as much. There's no magical machine, there's no magical rev scheme that makes all this bulking up happen. It's your diet that you're intaking. So when a woman tells you they're going to bulk up, they can't. Plus, they don't have the testosterone levels in their body to bulk up, especially as you get older in age.
You know, you mentioned diet. The guys that I see in the gym who are these big, muscular guys, not like me, so they're doing that in a combination of diet, intake, as well as exercise?
As well as some other stuff, too.
Okay, all right. So those
guys you see that they're morphed a little, they have some other supplemental help.
They have other supplemental help.
But they're also, yes, and those guys, what you don't realize, those guys are also probably putting in about 7,000 calories a daily also.
Wow. Okay, you know what, Marc, we're going to come back and continue this discussion. It's Dr. Kenny Levine with Health Talk. We'll see you in just a moment. Thank you.
When you're smiling First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.